Hi, this is Dr. Moubayed, and I'm very excited to be talking to you today about Facetite and neck liposuction. So what is Facetite and liposuction? Imagine you're putting a steak on the barbecue. The heat makes the steak get tighter and shorter. Well, this is like Facetite. Facetite is when we take a radio frequency, introduce it in the neck, underneath the skin using 3 small incisions, 2 behind the ears and 1 under the chin, and this radio energy produces heat that then tightens the skin over the next 3 to 6 months. And this heat also makes the fat melt. So the liposuction goes and removes all that melted fat to sculpt the neck even more. Who's a good candidate for Facetite and liposuction? It's somebody with mild to moderate skin laxity, extra fat at the level of the neck, and especially realistic expectations, because we're not looking for perfection, we're looking for an improvement. A rare risk of Facetite and neck liposuction is injury to the facial nerve that makes your lower lip move. This is why it's important to choose a surgeon that is well trained in head and neck surgery to avoid injury to that nerve. How is Facetite and neck liposuction performed? You come in the day of procedure, meet our team, and get an IV. We then do very precise markings to draw out all the important anatomical structures in your face and neck to avoid injuring any important nerves. We then inject your neck with a solution that contains lidocaine to decrease pain, adrenaline to decrease any bruising or blood loss, and bicarbonate to decrease pain during the injection. After the skin is disinfected, we do 3 small incisions, 1 under the chin and 2 behind your earlobes. We can then use a cannula to separate the skin from the underlying structures. It's very important to stay in the right plane, not to injure any nerves at that point. And that's when we introduce the Facetite probe that brings heat into the tissues and brings up the temperature of the skin inside to 50 degrees Celsius usually, and outside to 35 degrees Celsius. And we try to get an even distribution of the heat throughout the skin of the face and neck. Once the target temperature is achieved, we then move on to the liposuction to remove all the melted fat from the neck area. The 3 little incisions are then closed delicately, and we put on an elastic bandage, supports your chin and your neck, and that you will keep on for the whole week. You can expect to be presentable after 1 to 2 weeks, but the full effects of the collagen stimulation usually take 3 to 6 months. The effect of Facetite lasts up to 5 years, while the effects of liposuction are usually permanent. Most of our patients tell us that the recovery is almost pain-free. Thanks for stopping by, and if we left anything out, please ask us your questions below.